Good evening. Almost 4,000 long-term care residents have died of COVID-19 in Ontario. And now we have testimony from 3 of the top decision makers in the Ford government about who knew what and when as the pandemic struck and what actions they took. After reading hundreds of pages of what they said before the Long-Term Care Commission, it is clear it wasn't just one failure that led to the deaths of thousands of vulnerable seniors. It was a series of multiple failures.
Didn't this minister then go public and speak up and save lives when obviously...
In question period, the opposition grilled long-term care minister Marilee Fullerton, who's a retired doctor, after commission transcripts revealed she was worried about asymptomatic spread in long-term care homes as early as February 5th. Fullerton says she told the chief medical officer of health her concerns.
I don't know exactly which conversation that was.
The same month Fullerton noted concerns about asymptomatic spread, the Centre for Disease Control said COVID can be spread by people who aren't exhibiting symptoms. But Ontario's Chief Medical Officer of Health testified he didn't accept asymptomatic spread until months later in the summer. NDP leader Andrea Horwath asked the Minister of Long-Term Care why she didn't speak out about the danger.
I was not the public health expert.
And the disconnect obviously led to lost lives.
Dr. Amit Arya saw residents dying in long-term care homes firsthand.
Had we prepared, at the time in February when the minister was concerned and there was a government response which made sure that there was proper infection control in the homes and there was PPE for all the staff available and there was accountability around infection control, perhaps we wouldn't have seen what we saw.
In his testimony, the Chief Medical Officer of Health told the Commission he relied on infection control in long-term care homes to stop the spread, but at the same time acknowledged their record on that was poor. And the vast majority of PPE, which PSWs were begging for as the first wave swept through homes, had been destroyed by 2019 because it expired. The government's move to buy more pre-pandemic was hampered when it switched to a centralized procurement system. When the Commission asked Health Minister Christine Elliott if she raised concerns about that, she replied there was an expectation it would be replenished.
By and large, this was a preventable tragedy.
Lack of staffing became a crisis when the pandemic hit, but the government waited until last week to announce free tuition for thousands of new PSWs. Begging the question, why did that take so long?
Dr. Fullerton, she's the champion.
And thank you to the member opposite.
The minister herself blamed COVID for the deaths.
The heat of the moment as crucial decisions were being made in February and March. What was the biggest failure?
Well, the biggest failure, and it's nobody's fault, is the speed with which COVID-19 moves.
The Long-Term Care Commission's report is due at the end of April, and they asked the government for more time to examine how COVID could have killed so many. Their request was denied.